Hello, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. I want to talk to you about common therapies for high blood pressure which do not involve medications. The 5 common non-drug therapies are dietary sodium restriction, exercise, weight loss, avoiding alcohol, and eating a high-fiber, low-fat, low-sugar diet. Non-drug therapy is generally recommended whenever a person has mild hypertension, that is, when the top number is less than 160 and the bottom number is less than 95, and whenever a person feels well, that is, has no chest pains or unusual shortness of breath. We will often recommend non-drug therapy for 1 or 2 months to see if blood pressure can be lowered naturally without having to resort to medications. Salt or sodium restriction is a form of therapy that will, on average, lower blood pressure 5 to 7 points. Some people, however, don't receive any benefit from sodium restriction, while others improve significantly. Thin people benefit more from sodium restriction than people who are overweight. Current recommendations are that sodium ingestion be limited to less than 2,000 milligrams per day. To accomplish this, you must first refrain from adding salt to food at the table. Second, you will need to avoid foods which have large amounts of sodium, such as pickles, bacon, and ham, lunch meats, canned foods, microwave dinners, and the like. Third, limit the amount of restaurant food you consume, since most restaurants serve food containing large amounts of sodium. For more information on sodium, please ask to see our video on salt. Exercise is an excellent form of therapy for high blood pressure. Recent advances in exercise research have shown that low-level aerobic exercises are every bit as effective as strenuous exercise in reducing blood pressure. The most important issue in exercise is the total energy of exercise. The optimum benefit from exercise is realized when you burn 2,000 calories per week. Since 100 calories are burned when walking or running 1 mile, the optimum benefit from exercise is achieved when a person walks or runs 20 miles per week. The major difference is that it's much more pleasant and much safer to walk 20 miles per week than run 20 miles per week. If you have not been physically active, then it's best to begin by walking a half a mile 3 or 4 times per week. Don't try to go too fast. That will come with time. Gradually, you can build up to 3 miles per day. If you don't want to walk on the streets or have access to a treadmill, join the people who walk in the shopping malls. A major cause of high blood pressure is consumption of alcohol. That includes mixed drinks, wine, and even beer. Only 20% of people who totally avoid alcohol will develop high blood pressure, but 35% of those who consume an average of 3 drinks per day will develop high blood pressure, and 50% of those who drink 6 or more drinks per day. For this reason, if you have high blood pressure, avoiding alcohol may enable you to bring your blood pressure under control without using medication. Losing weight is another important non-drug therapy for high blood pressure. Of course, people who are overweight will benefit the most. Very frequently, losing just 10 pounds can result in normalization of blood pressure. Very few people need to lose more than 20 pounds to reduce high blood pressure. The most effective way to lose weight is by participating in an exercise program and eating a diet which is low in fat and sugar. Low-fat and low-sugar diets, which are high in fiber, have also been shown to not only reduce blood pressure, but also to lower cholesterol. It's currently recommended that all Americans eat a diet which obtains only 30% of its calories from fat. Diets which contain less than 20% of fat calories typically produce large amounts of weight loss without producing hunger. The percentage of fat calories is calculated by looking at the food labels and dividing the fat calories by the total calories. For example, if a food has 105 total calories and fat calories are listed at 35, the actual percent of fat calories will be 35 divided by 105, or 33%. The food industry often misleads consumers when it comes to listing fat calories. For example, 82% fat-free turkey bologna appears to be a low-fat product. The fact is, It's 82% fat-free by weight, not percentage of fat calories. The actual percentage of fat calories in this product is around 75%. All fried foods are particularly high in fat. French fries are 55% fat, potato chips are 68% fat calories, cheddar cheese is 79% fat calories, while the so-called low-fat mozzarella cheese is 50% fat calories. It's only low in fat compared to regular cheese. Fortunately, the new fat-free cheeses are actually very low in fat and healthy to eat. Other high-fat items include peanut butter, which is 75% fat calories, pepperoni pizza, which is 53% fat calories, and as you can see, there's a lot of fat in popular American foods. This is why you need to read the labels and calculate the percent of fat calories prior to eating something. For more information on foods, please ask to see our video on nutrition. In summary, whenever a person who is in good health and feels good is found to have high blood pressure, we generally want to wait 1 or 2 months to see if that person can bring their blood pressure down naturally. The 5 common non-drug therapies are dietary sodium restriction, exercise, weight loss, avoiding alcohol, and eating a high-fiber, low-fat, low-sugar diet. If the top number of blood pressure remains greater than 140 or the bottom number remains greater than 90 despite non-drug therapy, medication should be started. Patients who have blood pressures greater than 160/90 should have it rechecked in 1 or 2 days to be certain that it's consistently high. If it is, medication should be started. At a later point in time, if a person changes diet, loses weight, reduces alcohol consumption, and maintains an exercise program, medications can sometimes be reduced or possibly stopped. I hope this educational video has helped you understand the basics of non-drug therapy for high blood pressure. Working together, we can effectively treat high blood pressure and prevent complications from this condition. This is Dr. Eli Whitney from the Heart and Vascular Institute of Texas.